some fabulous scientific research there, and you should all be very proud of that. If we're going to take this research and translate it into positive action, it's really important that it be accompanied by facilitating policy environments. So now we're going to move on to policy activities within the hub and looking at how we can make them deliver for both poultry and for people. Very brief overview of what we're going to look at. We're going to look at the challenge that the policy folk were set at the beginning of the hub's work, look at specific activities within the countries, looking at hub-wide activities, what we've learned, and some of the impacts that we've seen. And it's really important that I acknowledge that what's about to be presented has been the work of a fabulous team, and it's been my privilege to work with them. So the challenge that we were set, as outlined by Iona at the start, is we're seeing a huge increase in the global demand for chicken meat and eggs. And the question is, how do we meet this demand and deliver safe and sustainable poultry products? Within the hub's theory of change, so the framework that set the objectives and the activities that were going to deliver those objectives, we had two main categories. One was looking at enhanced multi-stakeholder processes to discuss research, policies and innovations on poultry intensification, and also to look at understanding what's driving stakeholders, to understanding regulatory frameworks and the risks that are associated with poultry intensification. I've included this rather complex figure just to remind us of the complex environment in which we were working. So the words that are written in yellow, they're representing the different sectors within national governments. We've got purple lines showing the movement of nutrients, because the reason these poultry systems are there are to deliver food for people. So while we tend to focus, we vets anyway, tend to focus on the pathogens, outside that, these systems are there, they persist, they're important because they're delivering food to people. And what I'd really like to emphasise here is that underpinning these different sectoral specific agencies or ministries, outside all of that we have the natural environment as represented by the Ministry of the Environment and usually Natural Resources. But you'll see on the left-hand side, I'm talking about the resource environment. If we're going to do One Health well, we need to ensure that there's resources there. So it's really important, wherever possible, that we're working with ministries of planning and finance to ensure that they understand where the key activities and key bottlenecks are in order to deliver safe and sustainable food. And this is a whole of government activity. We can work, and we do need to work within our sectors, but we need to have those cross-sectoral linkages, and we need them to work well. Each of our countries decided what they wanted to focus on in terms of their policy activities. In Bangladesh, Rukan and his fabulous team of graduate students focused on three key areas, and they've delivered on those. We have policy briefs. The first one looking at what more needs to be done to operationalise One Health in Bangladesh, a recognition of their great achievements, of their commitment to One Health, but recognising that their intersectoral collaboration still has a way to go and that it's not operational at the community level. Looking at how private and public sector can work together better in relation to poultry health. So coming up, there was an agreement to come up with a uniform approach to training modules, and also to have an agreement of when the private sector's training, who are they training, and how can the public sector training complement that activity to ensure that poultry producers across the different production systems are receiving the information they need. And the third one was looking at poultry producer understanding of policies. When we look at policies, there's usually no shortage of policies, but almost no one in the field knows about them. This was no exception in Bangladesh. Farmers were unaware of most of the policies, and so it was a recognition that we do need to improve that, but also we need more than the regulation Regulations need to be accompanied by standards and guidelines to help translation into practices that will be feasible for each of the production systems. In India, Rajiv and his team in New Delhi focused on two main activities. There was a national webinar series looking at, once again, opportunities for implementing One Health all the way down to the community level, discussing the synergies and the trade-offs when we're talking about delivering safe and nutritious poultry products, dealing with food safety issues, but also achieving food security. The third one there, for those of you that can read the title, has COVID-19 improved prospects of One Health in India? This was a national roundtable, representatives from the multilateral organisation, from national government and from civil society. The first question is, what's a poultry hub doing talking about COVID-19? It was a great example of the hub's flexibility and willingness to take a systems approach to learn from various shocks how we can do One Health better and to come up with those common issues that we need to tackle. And clearly one topic that got a lot of discussion was AMR, was the need to share data across sectors, and also the importance of involving community members in the work that we're doing. In Sri Lanka, there was a focus on policy. There was a recognition that while they had animal health legislation, there was no legislation, no policy specific for poultry. One of their first activities was to do a policy mapping, to do an analysis, to look at what was there, and also to look from a broader perspective. Are those policies catering to the range of producers, to the range of value chain actors? Are they taking into account those different characteristics, including the genders? We know that poultry production across the sectors, the different production systems, tends to be very gendered. Are the policies taking these sorts of things into account? After the mapping, Ruani and her team implemented an excellent roundtable where they were looking at how can the national poultry industry become resilient, be sustainable. Once again, great representation by the private sector, public sector, academia and civil society. And those findings led in and accompanied the development of a poultry-specific policy, which, congratulations, Ruani, is now up for public consultation. People are able to comment on that, and the hope is that that will then go for ratification within the government. In Vietnam, very strong focus on antimicrobial resistance. Vietnam was one of the first countries to really recognise this as a problem, to develop their action plan, and there's a recognition that while it was recognised, there's still many challenges to deal with. The hub, in terms of policy, facilitated two high-level antimicrobial resistance meetings held in Hanoi with representations from the private sector, the public sector, civil society. They were held in 2023 and again in July this year. Ahead of the July meeting, Hung from the Vietnam National University of Agriculture, under the supervision of Hoa and Prof. Ton, did a great job of reviewing existing policies. So looking at AMR-related policy in human health, in animal health, and in the Ministry of the Environment and Natural Resources. It was an excellent presentation that really highlighted that while there may be policies, once again, they're not always known by the people who really need to comply with them, and importantly identified a complete gap in terms of the environment, where there was no existing policy that would allow them to do the monitoring and then respond to what they were finding. Following the recent meeting, we had really fabulous feedback from Matthew in the British Embassy in Hanoi, who was really grateful for the way that the hub coordinated with the ministries, facilitated the ministries in implementing these meetings, but also worked in collaboration to support the Fleming Fund work. And one of the key findings, he said, was that within the Vietnam context, the government really recognises and appreciates what UK aid is doing to support tackling antimicrobial resistance. And that was echoed very strongly from our colleague Ms. Fu within the Ministry of Agriculture and Rural Development, who was grateful for that support that was timely but was also patient to allow things to happen when the timing was right to be able to get the results. And that has been reflected in the report that's generated with very strong recommendations about improved cross-sectoral coordination, but also those policy gaps. Another piece of work that was led by the Vietnam National University of Agriculture and IDS focused on poultry slaughterhouses. This was emphasised in both presentations really preceding this. And the nice work that was done over time at the provincial level and was presented at a national meeting earlier this year that came up with very clear policy recommendations that were specific for province and city levels and also for national levels. So that work is going to make a significant difference moving forward. I wanted to give you one example of small things that can make a big difference. In Bangladesh, the hub agreed to work with another project that focused on ruminants to try and facilitate the implementation of a One Health approach at the sub-district level. So the sub-district is in Shakaria, and the important thing when we were reporting back to a national meeting on the findings from the initial stage of this project, we had human health, we had animal health, we had the environment present, and it's really important to recognise that in terms of human health, Bangladesh has one of the highest rates of immunisation of children in the world. They've done a fabulous job, and despite these high-level rates of immunisation, stunting remains a problem. And what we find and what is recommended in many countries, or what is found, is that often these children have insufficient access to animal source food. And so when my colleagues in Bangladesh did all the hard work of doing the survey, what they found was if you're asking farmers in this area, in terms of vaccination, what are we seeing for lumpy skin? 12% of the herd in that area had received vaccination. 6% had been vaccinated against foot and mouth disease. 7% against anthrax. For PPR, an important disease in small ruminants, a better result. In terms of chickens, vaccination of deshi, so the village indigenous chicken or the commercial broiler, so low that if the disease goes through, you're going to have higher levels of mortality. For those of you who don't know Newcastle disease, it's part of the measles family of viruses, and it's a key differential diagnosis for avian influenza. So if you've got birds dying from Newcastle disease, in the field you don't know, is it Newcastle, is it avian influenza, presents a very complex picture. When we presented these results, our human health colleagues were horrified. What they wanted to know was, how do we help? So very practical. They're going to help. They're saying, we're going to help you with your cold chain. We're going to help with training. We're going to help with monitoring your cold chain. And what they want to know at that district level, they have nutrition committees at each district. They want feedback on levels of vaccination in livestock going into those committee meetings. And they want that information shared with human health. They want it shared with animal health clearly, but also other sectors. And the cyclone prevention program in the coastal area of Bangladesh has excellent connections and communication lines all the way to each village there, and so they can be involved with sharing this information. So it was a great result, and sometimes we're embarrassed to share when things are not going well, but when you've got partners that want to work with you, the only way they can help you is if you let them know where your problems are. So now on to broader activities. Last month, the Hub worked with the World Organization for Animal Health to co-host a workshop in South Korea on avian diseases. The key output from the Hub's perspective is that it provided an example for representatives from each of the Hub countries to present real and current findings to inform the decisions that were being made there. They focused on avian influenza, AMR, on policies, but was really context-specific and complemented some of the results that is currently in the literature, which may be dated or incomplete. One of the great things that the Hub has done well is the soundness of their research design that give you a much clearer picture of what's really happening, and that was very much appreciated at this meeting. So what have we learnt? We've learned, no surprise, intersectoral and interdisciplinary work takes significant resources, time. It doesn't happen quickly. The great results that you've seen presented here is built on people knowing and trusting each other, and that takes time to develop. You have requirements for both human and financial resources, and importantly, you need to create a safe space where people can feel okay about sharing those challenges across the various barriers that divide us. And this is an iterative process. It doesn't stop, but it does take time. And the recent One Health report shared by Star IDAS indicated the importance of time. We have issues that need to be dealt with urgently, but we also need to take time to develop those relationships that are going to give us the result that we really need. One of the great pleasures during the Hub was also implementing a series of webinars that were open to participants globally. And the idea was to look at the various key groupings of aspects that relate to poultry production, poultry consumption, poultry trading. And this ran over almost 12 months. We had a series of panellists, many of whom are going to appear shortly. Thank you very much for doubling up. And they were asked to give key messages. Participants also shared messages. And we focused on poultry production and distribution systems, on food systems, which is why these poultry systems exist. There was a strong focus on disease and pandemics and on the governance of disease, and culminated in a discussion around food systems governance. There's a recognition that while we understand the importance of food safety and pathogens, so much of what is done is governed by commodities, the trade in food and those food systems. So to get things working better, we have to have a strong look at food systems governance. And the messages and the key messages that we received were able to be clustered into 9 main themes. The most important of one here is about the importance of One Health governance and implementation in the future. So that means it really is the Hub's legacy, is to help to support improving that governance, but also helping people to understand that you need to understand the complex systems in which you work, and most importantly, having your champions, trusted champions, within those various actors across those different systems. Thank you so much to all of you. You've done a great job.